Welcome to the Body Shop Physical Therapy. I'm going to go over blood flow restriction training. Please consult your physical therapist or medical doctor for the appropriateness of this intervention for you. It has been shown to be safe and effective for strengthening muscles, especially when the joint is unable to handle a high mechanical load. Before I begin, I'm going to start with a word of life from 2 Corinthians 12:9. And Jesus said to me, "My grace is sufficient for you, for my strength is made perfect in weakness. Therefore, most gladly I will rather boast in my infirmities, that the power of Christ may rest upon me." Amen. Okay, so what is blood flow restriction training? That is when you are going to create an anaerobic environment, which is what happens when you're strengthening muscles. So tension over time, when you are lifting a heavy weight or doing a high load, high intensity workout, you are putting your muscle under tension, and that is going to then stimulate the mTOR pathway, which is just muscle building. So you create all these cellular responses to help build muscle. And so we're going to create this by restricting the blood flow to the muscle. And this is for someone that has arthritis in the joint, or you could have a tendinopathy, a tendinitis. You could be recovering from a surgery for a ligament repair, such as an ACL repair. When you have surgery in your knee and it swells, it will shut the quadricep muscle down, and so it's a way to prevent atrophy as you're recovering. And there can be a number of different problems that this can be used for, but the main reason that you want to use this is you want to keep the muscle, you want to strengthen the muscle without having a high mechanical load. And the studies have shown that you can increase muscle and similarly to having a high workload. And you can do this with low to very little weight or work. So it is not comfortable, so you're going to get the same feeling, sensation as if you're lifting a heavy weight, but it'll be very light. So there's a number of devices out there that you can use. I have no preference. I am going to use the Smart Cuffs. It is an FDA approved device, and you want to use, there are other FDA approved devices that is just going to assure you the safety and the accuracy that you are getting the amount of blood flow restriction that you're looking for. You don't want to just tourniquet your leg or wrap something to cut off blood flow to your leg and not know how much you are cutting off, if you want to be consistent with what the literature is showing and to stay safe. So you do want to use a safe device when you do this. And this is where you're going to take a cuff and restrict the blood flow. There are arm cuffs and there are leg cuffs. You do not ever want to use all 4 limbs restricted. So you can do 2 at a time. I could do both arms, I could do both legs. Never do I want to put cuffs on both arms and both legs at the same time. So that is going to be one contraindication. But I am going to do blood flow restriction training for my legs. And if I have a injury to my knee, if you've got arthritis in your knees, or if you are unable to do a heavy workload because of pain, and you want to get stronger, this is going to be a good intervention to do. So I'm going to strap the cuff onto each leg, and you want to place the cuffs as high up into the groin area as possible. And I'm going to hook both legs. And as I turn and go through these, I'm going to tell you what the protocol is for exercise with the blood flow restriction training and what is happening. So I've got 2 different pumps, and you can just do one limb. Let's say I have an injury on one side, I can just do blood flow restriction training on one side. And the guesswork has been taken out. So when you have these devices, it's kind of like a calculator. If you know what you're looking for, you put in the numbers and you plug, and it does all the settings for you. So in the legs, You want to do between 60 and 80% LOP, which is limb occlusion pressure, and that's just how much you're going to restrict. So I can restrict up to 80% of the arterial blood flow and get results with strengthening in my legs. So I'm going to go to the leg protocol, and I'm going to set up to restrict 80%. And you want to calculate this every week. Once you know, this is not the same thing as your blood pressure. So you want to calculate it, and it does change depending on what's going on. So it's nice to do a check every week. Now for the arms, you can do between 40 and 60%. And this is not comfortable, so it's usually a good idea just to do the restriction and allow yourself to see what it feels like before you ever participate in the exercise. So this is going to be set up for 80% blood flow restriction in my left leg, and so then I'm going to set it up for my right leg. And again, it is arterial occlusion, so we are restricting the blood flow, which is going to, your blood's going to carry oxygen, so we're creating an anaerobic. We're taking the oxygen or restrict the amount of oxygen that is going to the muscle, and that's going to create that type 2 fiber muscle building activity. So this is for somebody that wants to build muscle. And it's got to, the machine is going to calculate it for you, and then it will go up to that 80% restriction of arterial occlusion. And then when I get that, I will take off the pumps, and then we will do our exercise. So what's happening? I'm restricting the blood flow to the muscle, and that is going to then create cell swelling. So I'm going to get cell swelling, and that swelling is going to stimulate their satellite cells in the muscle. And satellite cells are stem cells, so they are going to make new muscle. And if those get stimulated, then I'm going to start to have that signaling to develop new muscle. So the cell swelling is going to do that. The anaerobic environment, not having the oxygen in my muscle, is going to stimulate growth hormone and IGF. IGF is insulin-like growth factor, and that's needed to build muscle. Also, when the satellite cells get stimulated, the myostatin, so if myostatin is present, that inhibits muscle building. So if I inhibit myostatin, then that is going to allow the muscles to build. So I'm getting a hormetic response when I restrict the oxygen in my muscle tissue and have this cellular swelling in environment. So the first thing that happens once you restrict the blood flow, you will start to see that the muscle is going to swell up, and that is going to be the cell swelling part of the blood flow restriction. So we are set on this left leg, and now it's pumping up, and I am going to be set on the right leg. So I have now on both my legs, 80% of the arterial blood flow has been restricted. And the protocol for exercise with the restriction is going to be 30 repetitions, 30-second rest, 15 repetitions, 30-second rest, 15 repetitions, 30-second rest, and 15 repetitions. So it's going to be 30, 15, 15, and 15. Now, what I do is I do a lot of isometrics if the joint does not take high mechanical stress, but I'm going to do this with the blood flow restriction, and I'm going to get a more high intensity reaction to the muscle, but with no load on the legs. So I'm going to start with straight leg raises. So today I am going to build my quadricep muscle using BFR training. The first exercise is going to be straight leg raises. So I am just going to lift my leg 30 times, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And while this leg rests, I'm going to do the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now I'm going to go back to my left leg and I'm going to do 15 repetitions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And take a rest. I'm going to take a pause and I can already feel the burn in the legs. So I want to have between 30 seconds to a minute rest in between, and so I'm just going to take a pause and then do 15 on this right leg. So I want to tighten my thigh, get that quadricep activated, and then lift. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and then I'm going to switch back to the left side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and rest. This is my second set, and I'm going to do 3 sets of 15. Second set on the right side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and rest. Then I'm going to go back to the left side, tightening my thigh, lifting for 15 more. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Take a pause. Take a little bit longer pause to get that 30 seconds between my sets or repetitions. And last time on the right side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and rest. So I have an anaerobic reaction going on in my legs, and it does burn. It feels like a heavy workout. So after I've done that, I can then deflate the cuffs and do another exercise. I'm going to leave them on, and I can see you can have the legs, they can turn purple, you can get tingling. That's all normal reactions with the blood flow restriction. Another exercise I can do, so if I've got arthritis in my knees, if I try to do a heavy open chain load, that's a lot of strain on the joint, and sometimes the joint does not like that. So before I can tolerate a heavier load, I can use the restriction, and I can do an open chain exercise, so I can just extend the leg and bring it right back down. And so I can do the same protocol 30 times. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, and then switching to the left side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 15 on the right side for the first set of 15, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, taking a pause. And then switching to the left side for the first set of 15. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So we've got 2 more sets of 15 each leg. And you want to do the strengthening exercises if you can, the BFR 3 times a week, and you should show muscle building and muscle changes over a span of 8 to 12 weeks. You can build muscle. All right, right side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, taking a pause. Second set on my left side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and taking a pause. One more repetition or set of 15 on each leg. Right now I'm experiencing the burning sensation. The legs are swelling, and it does feel like I have lifted a heavy weight, and I have no weights on my legs except the weight of the shoe. And then last set. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Take a pause. And the last set on my left side. 15, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. So I could deflate the cuffs right now and then go into another exercise. I'm gonna go ahead and leave them on. If you can progress then to squatting with no weight and air squats, doing the same prescription of 30, 15, 15, and 15, and that is how you can build muscle there. So I've got the blood pressure cuffs on, or the pressure cuffs on, and then I just want to keep my knee in line with my second toe, and then I can go through a series of squats. So from the side, you want your toes facing forward, and I'm going to sit back and do a squat. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Woo! And it is burning. So I want to rest. 30-second rest in between. Slowing the heart rate down by slowing the exhale, taking a breath in. Two more deep breaths. Okay. And our first set of 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And then in between, you can even do heel raises, you can do walk around, you can even do aerobic walking with the cuffs on, and you can simulate that anaerobic environment. And I can feel that I get winded. All right. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. I'm going to do another set of 15. 1, 2, it's burning. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and resting, and then in for my last set. And then I am definitely going to want to deflate these cuffs. Woo! And the rest time is important, so you want to make sure that you are resting the 30 seconds to 45 seconds, even up to a minute if necessary. And there is a training effect, and as you do these more often, it does get to be easier and easier. And then once you're able to tolerate a high mechanical load or higher intensity, then you want to go ahead and start using the weight and strengthening it at a higher intensity. All right, this is my last set of 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, last one, 15. Woo! And then I'm going to come down and deflate the cuffs. Woo! So that's intense, and there is no weight or mechanical stress, and it feels great. And when you do stimulate type 2 muscle fibers, that can help with pain too. So if you're having joint pain, you have arthritis, you have an injury that keeps you from having high mechanical stress, and you want to keep your muscles from atrophying, you want to build muscle, this is a great intervention to do to be able to strengthen your body, strengthen those muscles, get the joints healthy so that you can then go on and do exercise with weight and that higher mechanical stress. So I hope this is of help, and if you do happen to have any of these problems and are looking for a good way to get that exercise and those hormetic changes that can build muscle and improve your health, then I wish you well in pursuing these interventions. If you have any comments or questions, please leave them, and if this is of benefit to you and you find it helpful, please subscribe to my channel, and I will continue to give tips and intervention techniques that are out there that may improve the quality of your life. Have a blessed day, and thank you.